everyone. Today I'd like to discuss what an exercise stress test is all about. One of the commonest tests that me as a cardiologist, what we often do is a treadmill test when somebody comes to our clinic for a heart assessment. But what exactly is a stress test? Well, a stress test is basically, as the name implies, a test where we try to stress the heart out. And this is often done either using a bicycle or running on a treadmill. In Malaysia, most of us actually use the treadmill, but in some countries, the bicycle is a more popular way of assessing the heart. So in Malaysia, patients are often put on a treadmill, and when they run in the stress test, electrodes are attached to their chest wall, connected up to the electrocardiogram or the ECG machine. And that allows us to assess the heart function when the patient is exercising. So the gist of it is the stress test is done to provoke stress on the heart so that we can assess and see if there is any strain on the heart when we exercise. One of the questions people often ask me is, at what age should I do a stress test? Well, for people with risk factors, obviously we want to do a stress test or screen for heart disease at an earlier age. And of course, if you have multiple risk factors, or the more risk factors you have, then the higher risk you are, then our threshold for doing a stress test will be much lower.
Generally speaking, for fit and healthy individuals, I would recommend doing a stress test from the age of 40 years old and above. This can be done as part of a routine medical checkup, and patients often come and do this stress test on an annual basis. However, the stress test can also be offered to younger patients, especially if patients have symptoms, especially when patients present with chest pains or breathing difficulties. And also if they have cardiovascular risk factors, patients, for example, with a strong family history of coronary heart disease, diabetes or hypertension. In this group of patients, you may wish to perform the stress test at an earlier age. However, there is a caveat with this. Performing the stress test in the younger population is often associated with false positives. The stress test has a lower sensitivity and specificity, especially in younger women, and hence the likelihood of having false readings are more common in this younger population.
So how is the stress test done? The stress test is actually a very simple test. It's a non-invasive test done by very much like the ECG or electrocardiogram test that we spoke about, where electrodes are placed on the body, and the only difference is this is like an ECG but done whilst you're running. So basically it's a functional assessment of the heart electrical activity when you exercise. So the whole idea is to get you to run, and in fact it's a standardized protocol worldwide. When somebody runs on a treadmill, the stress test will go in stages of 3 minutes, and the heart rate will pick up, the blood pressure will pick up, and we monitor that while the patient is running. However, the risk of having a heart attack during a stress test is actually very low. This is because the blood pressure and heart rate is being monitored continuously, and there is also a heart monitor in place. And hence, if there's any abnormalities seen during the test, which is being done in a gradual manner, the patient does not run straight away, it starts off slowly, it gets faster and faster in stages. So it's all done in a gradual manner. If there's any signs of a strain on the heart, the procedure is terminated and the test is stopped. So the likelihood of having a heart attack is actually very low with a stress test. Apart from that, it's actually a very, very safe procedure. As I say, it's non-invasive, so there's no radiation, there's no dye or contrast or chemicals injected. The stress test can be done often takes about roughly 15 to 30 minutes to complete the test, because the patients will run in stages of 3 minutes. So each stage is 3 minutes. On average, most people run about roughly 8 to 10 minutes on the treadmill. So when you come for a stress test, one of the things that you do need to give yourself is probably you need to give yourself about 20 or 30 minutes allocated time, because we need to monitor your heart rate before the test, and you run for 8 to 10 minutes, and then we need to monitor your well-being during the recovery period for another 10 minutes or so.
Well, thank you for watching. I hope you liked the video. If you do, please don't forget to like, share and comment. Thank you.